Well, it's a pleasure to welcome everybody to today's webinar organized by the Care Policy Evaluation Center, LSE. My name is Michela Tinelli. I'm a researcher based at CPEC, and today I will chair the event. Today we will talk about the use of evidence to inform social care decisions. Before we start, I wanted just briefly to cover some housekeeping. So please keep yourself on mute during the presentations if you're not talking. If you want to ask questions, please use the chat functions on Zoom, but also the reaction button so you can raise your hand virtually. We will take questions at the end, so please take a note of the speakers and your questions, and we will cover them all. I wanted just also to say the copy of the slides, the presentation will be shared with everybody who registered, and also we will post the slide deck on the Essence Project website. Okay. As you can see, it's a very much packed agenda. I will let our speakers to introduce themselves and to talk you through their sections. We have Martin, Magda, Sherry, myself. We are all members of the Essence team, but we are very pleased to have our guest speakers, Peter and Adam. And we want to allow them enough time to bring their perspectives when using economic evidence for their work on homelessness and autism. So let's start with Martin. Martin, it's to you. Thank you.
Thank you, Magdalena. So I'm Martin Knapp. I'm Professor of Health and Social Care Policy at LSE and work alongside colleagues on the Essence project. And my task today is just very briefly to ease us into thinking about economic issues. So on the slide there, on the left-hand side, you will see 1, 2, 3, 4, 6 bullet points, which kind of indicate what we might think of as a good social care system. It's one that meets people's needs, that responds to people's preferences. What do they want to have in terms of the support and in their lives more generally, that it respects individual rights and dignity and culture, that it achieves fairness in a number of different ways, that it safeguards people who need that, and encourages social and community cohesion. So there'll be other objectives, of course, that you would identify for a social care system. On the right-hand side, then, what we put is perhaps also there are some other things that a social care system is looking for. It wants to make the best use of the resources it's got available, the staff, the buildings, the physical capital, the money, the budget, and so on. It wants to be affordable. You need to make sure that what we want to deliver to meet those needs, to satisfy those preferences, is affordable with today's budget, with today's staffing, to be sustainable in a financial sense in the long term, and maybe even if you have new interventions to generate some cashable savings. Although, you know, the purpose of a social care system is not to save money. The purpose of a social care system is to do the things on the left-hand side. Next slide, please. So the sort of essence of the Essence project, the basic premise of the Essence project is that we think economic evidence can help with decision making of various kinds in the social care system. And the reason for that, why do we need economic evidence? Well, it's blindingly obvious to those of us who are economists, but probably obvious to others as well, which is resources are scarce. We don't have enough staff to do everything that's demanded of them. We don't have enough budget to meet all needs or to satisfy all preferences, etc. And so what we have to do as a society, as a whole, or parts of society, such as a local authority that's commissioning services or an organisation that's delivering services, we have to ration. Ration is often a dirty word, but it's a word that means choice. We have to choose how to use our resources. And then at the bottom of the slide, what you've got there is that means that when the system or people within the system are thinking about changing the way that services are delivered or people are supported, there are a number of questions that need to be asked. Is that new intervention, that new service effective? Is it affordable and sustainable? The things I mentioned just now. Does it perhaps even save money, although that's not the main objective? And particularly, is it cost effective? So next slide, please. Now, this is a busy slide, just a response to Sophie Wood in the chat. Yes, we're going to make slides available to everybody after the webinar. The busy slide here is just, I'm not going to go through everything in here. These are some of the uses of evidence from economic studies, particularly evaluative studies, things that look at cost effectiveness, which I'm going to explain in a moment. So as I say, I'm not going to go through everything on the slide, but you can see there a number of different ways in which evidence of this kind can be used. We'll see central government, for example, using it to compare between different modes of delivery or different local authorities, different providers. Certainly you would expect commissioners of services to use economic evidence. And the third one down, if you're purchasing services yourselves, you're implicitly using economic evidence. It may not be a formal evaluation, but you're thinking about what would this service mean for me and do for me, and what do I have to pay in order to access it? So there's a whole range of different uses of evidence, and say the slides will be available earlier. You can ponder the rest of these if you want to. But what's important to note is that sometimes those different uses require slightly different analyses. So next slide, please. So the final slide from me is just to list some of the main types of economic evaluation. I'm going to talk to this slide for about 2 minutes. But if you want to, you could do a 25-hour course at LSE, which will cover the same territory. There's a lot that goes into this slide. There are different types of economic evaluation, and they mainly differ by reference to the second column, the outcome measures. Okay, you'll get studies which only look at costs, the cost minimization analysis, which is generally not very helpful. The second one down, cost effectiveness analysis, is saying, what is the primary outcome of our intervention? Is it, for example, to support people to live more independently? Is it to support people so that they have a higher level of well-being? Is it to provide better safeguarding? So we might have a single sort of natural, as we'd say, measure of outcome. And that would lead to comparison of two interventions or two policy approaches in terms of that outcome and what it would cost to achieve it. The third one down is what's called cost consequences analysis. And then you take all of these different outcomes. It's not just people living independently or being safeguarded or meeting their well-being needs. It's looking at all of them within the evaluation, which is more demanding, but the information is richer when it comes from that kind of study. I'm going to talk about just two more and then I'll hand over. So the fourth one down is cost utility analysis. And this is where the outcome, the things I mentioned already, gets turned into a generic measure, often called a utility measure. In the health field, it will be a quality adjusted life year. And this is a sort of information that NICE would use when it's drawing up its guidelines, making its recommendations for what gets delivered in the health system and increasingly now also in the social care system. So there are some advantages in using that measure. It allows comparison across different areas. The disadvantage is it doesn't perhaps reflect all the nuances of what's happening in people's lives and all the impacts of interventions. I'm going to stop at that point. The other three are types of economic evaluation, which you won't see very much. So we're going to talk about the Essence website now and the Essence project. And what you'll see on the Essence site will be examples of evaluations in those first 4 rows of the table. So I will hand over now to whoever comes next. I think it's Magda. So.
Thank you, Martin.
Great. Yeah, hi, I'm Magdalena Walbaum, a research officer based at CPEC as well. And with Shari, we will present a brief summary of the Essence Toolkit. So this is the website, so the Economics of Social Care Compendium. You can access it and then go through the website. It has lots of important and useful resources that we will explain shortly. So what are the aims of the Essence Toolkit is to gather economic evidence for adults and children's social care and make it available in a form that can help decision-making in these areas of social care. Also, we want to help improve understanding of economic evaluation through training and learning materials. So, for example, the webinar and other material that are available in the website. And fourth is identify adult and children's social care interventions where new economic evidence might be generated. So we're trying to get and capture the gaps and where can we create and generate new evidence. Next slide, please. So this is the second phase of the Essence. So the first phase was completed in April 2019. And this new study, so the Essence 2, started in June, and we're about to finish this second phase. The current team, we're all here present. So it's Martin Knapp, Michela, Tinelli, Annette Bauer, Helen Witherley, Ben Schlepper, myself, and Shari that will speak to you shortly. And again, the aim is to contribute to build on the Essence toolkit and to help decision makings and make better use of the resources. In 3 ways, mainly to find the economic evidence and make it available and accessible, and we will explain how we did it. Then to support capacity building in adult and children's social care, and to identify gaps in the evidence. Next slide, please. I'm not going to go into much depth into this because Martin already talked about economic evaluations, but we are trying to show if an intervention is cost effective and affordable, and paying like attention to the spread of the cost and outcomes across different budgets, sectors, and systems, and over different times. And we highlight and are doing some economic cases or case summaries of this evidence that is available in the website for you to look at. Next slide, please. And how do we work, and how does the project work? So we have done a few searches on the different databases. So kind of like doing a very a big search of all the economic evidence in social care. And then we have selected all the evidence with an iterative process with support of our advisory group and experts on the field. And we have 3 components that are available online for you to look at. So one is the individual case summaries written in non-technical language, where we summarize the economic evidence of certain intervention. And then the searchable database with the published evidence that we have. So you can see what are the topics that we looked at, what are the keywords, and all the published evidence that was available related to that topic. And then we also have glossary of terms and other resources for you to use. And all this work is completed with the support from the experts, especially our advisory group that we've had recurrent meetings with them, and they have advised on the evidence, on the case summaries, and the next steps of the work. Next slide, please. And now I'll leave Shari. She will explain a little bit more of the structure of the toolkit.
Hello, everyone. I'm Shari. So in essence, there are two toolkits available. The first toolkit being adult social care, which was developed in phase 1 of Essence. So this was done in April. So as you can see, the toolkit is divided into services and treatments for adult social care. So there's health services, housing, leisure and well-being, welfare and benefits, and adult social care being the main category. Currently, we have 24 published case summaries with a planned 28 more to be uploaded. Next slide, please. Yep. In the second phase of Essence, the Children's Social Care Toolkit was developed. So when we talk about children's social care, we're referring to all forms of personal care and other practical assistance for children, young families, so young people and families who need extra support. So this toolkit was adapted from the framework proposed by What Works for Children Social Care and Early Intervention. And it looks at children's social care practices and cost effectiveness within the UK. And it's categorized by 5 levels of socio-ecological interventions. So you can see there's family level, interpersonal level or child level, community organization level, and policy level, which could operate across a single or multiple sociological domains. So although we already have published case summaries for adult social care, there's more work underway for children's social care. case summaries to be published. Next slide, please. So as you can see, we have a page where you can look at the case studies. So the case summaries are structured in the following format. So you will see the cover page, the context, what is the intervention, is the intervention effective, what do people say about it, is the intervention cost effective, what is the quality of evidence, how's the intervention being implemented, other information, a contact person, and references. Next slide, please. So here's an example of a case summary. So when you click case studies, you'll see a list of the case studies along with key points available in per section of the case study. And if you want to know more about the case study, you just click the link highlighted, and then it allows you to print and download the full case summary as a PDF. And as Magda mentioned before, the case summaries are written in non-technical language, making it easily accessible, and it's about a 5-minute read. Next slide, please. And here's an example of what a full case summary would look like. Next slide, please. So how can the Essence Toolkit help you? Well, it allows researchers and non-researchers to search for evidence and map where service provision is supported by economic evidence. So it covers a wide variety of quality of evidence, and it covers as many social care interventions as possible for many different groups of people who draw on social care support. And it also allows us to identify gaps in evidence where we could fill it with new research, and it also allows you to disseminate your work. Next slide, please.
Great, and then finally, what is the current state and the next steps that we aim to do? So for now, we have generated more than 28 case summaries of evidence, and then we have more than 1,000 individual publications in the database. We are trying to always update the publications on the evidence published. So now what we are looking at is trying to build more capacity and awareness of the evidence, and also have a look at more on the strength of the evidence, because at the moment we just put there and put together all the published evidence, but we're working on looking at the strength of the evidence that is available. I'm not going to go through everything, but we are looking at identifying the gaps in the evidence so that we can create new research to fill some of them. We are evaluating the Essence Toolkit and then looking at some other ways of how to continue with this work now that our project will finish now in March, so carrying it on beyond March, and expanding to children's social care, because at the moment the main, first phase was adult. This second phase we included children social care, and now we want to expand on the children's social care. Yeah, and for the future is just continue updating and expanding the toolkit. Thank you. I think that's me.
Brilliant. Thank you, Magda. So now we are looking at a specific example of a case summary. We are looking one covering homelessness, and you can see Shari already explained to you how to access the case summaries. They are very much user-friendly. You can print them off from the toolkit. This specific case summary covers some modeling work that I personally did with other colleagues to showcase the cost effectiveness of discharge services for people who are homeless. It was part of a big NIHR project with King's College, UCLs, and other institutions. Peter was also involved, and Peter will explain to you more about service provisions, in particular in Oxfordshire. Now I just want to say something about what we have been doing. So as part of this big NIHR project, it took us more than 5 years to complete. We were able to showcase at the end that step-down beds are more cost-effective than homeless hospital discharge schemes that have no direct access to intermediate care, basically. So the evidence that we produced was then used by NICE to inform the current integrated care guidance for people who are homeless, but also the Department of Health and Social Care in England used evidence to inform now the implementation of a national program of out-of-hospital care across the nation. Myself, King's College, Michelle Corns, we co-led the evaluation of such implementation. And as part of the evaluation work, we looked very much to improve the quality of the information available to policymakers, to commissioners, service lead, and how really such evidence is presented. We worked also to make sure that what is the value of such information, and also how such information could be used. We did a lot of things. The report, the production of the report is still underway. The project was just completed last year. As part of the visualization, so we built a collection of dashboards that are reporting all different metrics that we collected. You can see it's a long list. And as part of the metrics, we have specific around economic outcomes for NHS, for broader public budgets, social care, housing, criminal justice, and more. We looked at service delivery costs. Everything is part of a collection of dashboards. So if you want to know more, you're very welcome to go on the website. Let's see website, there is a link on the screen and you can access this dashboard. More will be published very soon as part of reporting, but also as part of the Essence website. We are planning to have a dedicated summary to add to our collection. I want now to give more space to my colleague Peter to talk you through his experience of using the economic evidence. So I hope Peter is connected with us.
I hope so. Hello.
Hello.
You can hear me.
Good to see you, Peter.
Thank you. I've had to go in via my iPad, so hopefully this is working, but let's give it a go. Hello, I'm Peter Moore. I'm the Programme Manager for Oxfordshire's out-of-hospital care model. And yeah, first slide's up. Thank you. I'm not going to talk through every slide in detail because everyone can read what's up there. In essence, we came about in 2021, as Michela was talking about, with the HSC's shared outcome scheme. There was several sites around the country looking at ways of trying to work together across systems, really, in potentially new ways, certainly locally, around the outcomes that you can see there and the aims you can see there around preventing discharges to street and associated readmissions, really. That project is being reviewed and evaluated by KCL and LSE, as Michela alludes to. It was initially funding just for 15 months, and we're still going. We have funding currently till April 25, and a big reason for that is the economic data, or the data that led to economic findings and conclusions that LSE were able to provide. So I'll talk a little bit about that today and how we managed to keep going, because that wasn't the norm for these test sites. Okay, the next slide, please, Michela. So very quickly, this is just a visual model of the Oxfordshire way and what we're doing. Again, I'm not going to talk through it all, but approximately 50% of that is around safe discharges through our step-down beds. So we've grown from 4 step-down beds up to currently 27. It's quite a big growth. And again, the impact of the step-down service and how we've been able to provide evidence for that, thanks to the work of LSE and others, has made that possible. And then 50% of the model is around preventing readmissions and preventing rough sleeping. So it's a two sides of the same coin, really. So that's a visual, and you can share these slides and ask any questions if you like. Michela, next slide, please. So how did we go about it? It was quite a challenge to start up. Anyone who's done this non-recurrent funding LARC will know that you have to try and build trust quite quickly with some big organizations that are very busy. I think we were very lucky in that the data team in the NHS were great locally, and indeed I'm sure beyond, but my experience was really positive. So we were able to build good relationships quickly. We were able to, across 20 different organizations, get a robust data sharing agreement and consent forms. All of that took a load of work, but we got there. The relationship with LSE was really positive, really supportive, and very much a two-way conversation. The way we, the actual metrics we used and the way we collected the data evolved. A lot of qualitative evaluation was delivered by our lived experience group we got in Oxford. Again, that's just luck on my point of view. We were able to tap into that, but we got some really valuable insights there, which 100% complemented the financial impact when it came to being awarded ongoing funding. I'll perhaps talk about that more in a minute. Just focus a bit more on the impact, really. So the project evaluators were able to find us to be highly cost effective, and that there were perhaps cost avoidance, I don't know how people like to word it, cost savings, cost avoidance to various parts of the system, as it were. For example, mental health, the avoidance of having to place people out of county because we were able to safely and positively get people out of mental health wards who have been stranded there. There was a cost impact on that. That was, and all of these, and there were others, various cases where we've worked with people who had drawn costs from maybe housing and the police and obviously health, and LSE were able to put a figure to that. And it was so valuable because it got a lot of scrutiny, as you can imagine. So I would say the impact was that we're still here. Last year, we received the single largest Better Care Fund award for 23, 24 and 24, 25. And that wouldn't have been possible without this data and the robust data that really stood up to scrutiny. So that was amazing. I mean, there was other impacts beyond that, but I know that today's essence is on the financial data. We were able to actually refine our model as we went along. That was very powerful. We were able to benchmark against good practice elsewhere, for example, in clinical input into our step-down services. So there was a lot of benefits, but I think the single biggest one from the financial data is that we're still going, and indeed have grown massively from the very small model we started at. Yeah, I think the next slide, please, Michela. So what's next for the Oxfordshire out-of-hospital model? It's all data related, really. So we want to look at longer term outcomes. We've got really impressive figures around reductions in ED presentations for people who go through our step-down service 12 months before and 12 months after. You can see a significant reduction. But we want to look at longer term housing outcomes. So once people have left our step-down service, did the move work, we'd like to evaluate our preventative services more and better, and maybe that comes into what we're talking about with adult social care and the Essence model and project. We want to use the discrete choice evaluation data and the dashboard that Michela was alluding to help us refine our model. Maybe not design it, it's pretty well designed as it is, but just keep refining it so that it meets the needs of the people who use it and meets people's preferences. We have found, apart from being the right thing to do, you get better engagement when you build services around what people tell you they want. The ICB or the ICS, Oxfordshire, Berkshire, West and Buckinghamshire ICS have invested a lot of money in our model. As I said, the single largest award through the Best Care Fund in this 2 years. And they want, and we want, to make sure they're getting value for money, and that the money that's spent is being spent well and smartly. And one thing we'll be doing next is working with Michela on the dynamic dashboard to really measure various impacts and outcomes, but certainly system-wide, because we want to embed this model and this way of working. And to do that, we need to show the benefits across the system, whether that's with criminal justice or housing, etc. So that's what we're doing next, and that's from a provider and a commissioner's point of view. I would just say it made all the difference. We were able to really, with LSE's input and King's College input, we were able to make a really robust case to stay and indeed to grow. So I would encourage anyone to take that up if you get the opportunity. I think that's it for now.
Brilliant, Peter. Thank you so much indeed for your intervention. Yeah, I think you're pretty good in time actually. So hopefully Adam can talk us more about his experience of evidence use. Adam, I hope you don't mind to introduce yourselves as well.
That's great. Thank you. Can everybody hear me? Yeah. Good. So my name's Adam Micklethwaite. I'm director of the Autism Alliance, which is a partnership of not-for-profit organisations across the UK that support autistic people and their families. They do that through social care, through education, and through community support. And the Alliance has three main areas of focus. The first is policy. So we work to influence government policy, both directly with officials and ministers, and also through reports and papers that we produce. And that includes work with the Department for Health and Social Care, Department for Education, and others. Our second area of focus is practice. So the approaches and strategies that the member organisations of the Alliance use in order to support autistic people and help them to have better lives. And bringing together those organisations to do knowledge sharing and other practice exchange so that we can keep improving the work that we do. And our third area of focus is on campaigning, where we campaign publicly on issues that are of national importance to autistic people and their families. And I'll say more about a current campaign that we're running later. We are also working, I'm really pleased to say, with Martin and his team at the LSE on a current piece of work, which is going to be a study of the economic evidence relating to autism. And this will support dialogue with policymakers and also be used, we hope, to influence government policy more directly as we move towards the next election and in the immediate period afterwards. So autism is a key area of public policy for a number of reasons. Autistic people experience significantly poorer outcomes than the rest of the population across health, employment, education. There are also a specific set of barriers that make it hard to improve those outcomes, particularly thinking around the discrimination that autistic people still face across society and in services. But also an important area of policy because the economic footprint of autism across employment, across social care, health, justice is significant. And indeed, Martin and his team were involved in a piece of work to look at that around 10 years ago. It's also notable that the incidence of autism is continuing to increase. If you look at diagnosis rates, they've increased, one study suggested, by almost 800% in the last 20 years. So there's been a very steep increase. That's due to increases in public awareness and also changes to diagnostic criteria. But it does mean that autism is increasingly important as a part of public policy, as well as the inequalities that are already evident. So while there's a clear human rights case for policies that can improve the lives of autistic people, there's also a strong economic case. And this is important when it comes to policy influencing through exercises the government carries out, like budgets and spending reviews and autumn statements and others, where money is allocated to specific areas of policy and the relative effectiveness of policies is considered. So we're very interested in the economic evidence underpinning interventions that can improve autistic people's lives. In general, this is about showing how enabling autistic people to have happier, healthier, more fulfilled lives produces economic benefits of different types. So this could be in terms of employment, for example. Autistic people frequently have significant strengths and ensuring that their skills are fully utilised in employment can have impact on competitive advantage for particular firms. But more generally, we need to be working to improve the employment rate for autistic people, which is one of the lowest of any group in society. That obviously has potential economic benefits in terms of increased income, but also reduced spend on benefits. And a recent study that was produced by Pro Bono Economics suggested that doubling the employment rate for autistic people could yield as much as 1.5 billion for the economy each year. So there's clearly some good evidence and some good work to do around employment. The economic benefits could also be in terms of education. So looking at the effect of this is effectively about meeting needs within an education environment, so a school or an education setting, meeting the needs of autistic children, young people, as the basis for more effective learning and therefore better outcomes. That could be in terms of increased attendance at school, it could be in terms of achievement, and that would be both at an individual level, but also at a whole school level. So thinking about the impact of the overall learning environment and the way the school is led and run, and the way that the staff set up that learning environment and operate that for the children. And then finally, also in health and social care, obviously we're talking about social care here today. The effect really of investing in the right support early is the key issue for autistic people. Often you will see needs which are present from an early age escalate if the right support is not in place, and all too frequently, and in some cases tragically, that can involve family breakdown, the onset of crisis, and in some cases admission to mental health hospitals. So preventing that escalation of need by putting in place the right support as early as possible, enabling people to live in their communities, to thrive in their communities, is of the utmost importance. And that really is the key focus of our work on health and social care. And clearly there, what we're looking at is the comparative cost of not meeting needs and therefore having more expenditure focused on crisis support, and particularly inpatient care, which can be long-term care. The average length of stay for autistic people is around 5 years, which is just crazy, compared to the cost of getting it right first time by putting that support in at the community level, and therefore reducing those needs, but also the lifetime costs associated with providing the support. So in each case, the benefits of policies that support people can be monetized with varying levels of confidence, and that's something we're really interested in. You've moved to the next slide, which is great. Just one more point to say on the previous one, which is just alongside that, longer term, as the business continues to develop, there's an even broader area of potential focus, and that is how exploring how policies and services models that work for autistic people can improve outcomes for everyone, because the principles that they are based on are universal characteristics of better policies and services. So that's something we're very, very interested to. And if you can get it right for autistic people, and indeed, you know, the same would be true with people with a learning disability, and if other groups that have similar types of need. If you can get it right there, then you will be producing a system that delivers benefits for everybody, and really understanding how that could work, how that could manifest, and obviously what the economic benefits of such an approach could be, is a big area of focus for us down the line. And of course, that's a system of policy and service delivery that is about embracing difference, about meeting need, about putting support in early. So these are all the key principles that we are confident can deliver better outcomes for everybody, but having the economic evidence to back that up would be fantastic. Great. So next slide, and I'll finish off with some examples of how we are using or planning to use this type of evidence. So firstly, to influence government policy directly, as I said. The example I've given here is Real Change for Autistic People and Their Families. This was a paper the Autism Alliance produced last year. It tried to establish a simple point that if you look at outcomes for autistic people now, and you look at them 15 or 20 years ago, actually not a lot has changed. There are one or two minor increases, but basically we're looking at a flat line. So no progress really has been made in substantive terms. And that's despite dedicated legislation for autistic people, the Autism Act in 2009, despite successive government policies, despite so many commitments to improve outcomes, we're not seeing it. And the obvious reason we're not seeing it is because system level change has not happened. Policies that help autistic people have focused around the margins, really, focusing on guidance, focusing on specific initiatives, not really on how the whole system works. And that's what we need to do in order to achieve real change. So that was the document that we published, and to support that and other work that we're doing, as I said, we're working with Martin and his team on an economic study around autism, and that really will, the overall purpose of that is to highlight the cost effectiveness and also the scale of the potential economic benefit of doing policy in the right way for autistic people and their families. And to do that, we're looking at a range of different interventions, their relative economic strength and evidence, and then building scenarios that show if government spent money in a different way, what that would do to outcomes and also what it would do to costs. So we're looking forward to finishing off that work and being able to deploy that into our policy influencing with government and with officials. Secondly, we use this evidence as part of public campaigns. So the example, current example for the Autism Alliance is Breaking Point. This is a campaign that focuses on adult social care, and it tries to do two main things. So firstly, to highlight the fact that there is a gap in care, a gap in provision. There simply isn't enough money to pay for the support autistic people need. Again, the same is true of people with learning disabilities as well. But also to highlight the impact of this policy failure, let's call it that. Both in terms of the proportion of autistic people that reach crisis point, but also the relative cost of closing the gap versus the cost of the current situation, which is that too many people are in long-term inpatient care. So showing that if you move the funding from here to here, and there's more than enough to do it, you could close the gap and you could improve outcomes, but the system is not working in the right way. So having economic impact evidence to show even more clearly the impact of failing to meet the needs of autistic people on outcomes and costs is critically important here too. So Breaking Point is our current live campaign, and that will be running through to the end of April. Thirdly, and this goes to the previous part of our presentation today, to inform local commissioning of services. And this really is about taking what we can from the national level, working with our members, who are all local specialist charities that support autistic people and their families, frequently work with local authorities and are commissioned by them to influence that process, not just local authorities, of course, but integrated care boards as well, so that we can do our best to shift the model and understand how funding can be pulled back from crisis so that we can support people early in the community and get them the support that they need. And then fourthly and finally, to inform better practice. So the Autism Alliance has a key focus on helping our members and the wider not-for-profit sector to continue to improve what we do, and understanding approaches that increase outcomes and reduce costs is very important in helping us to zero in on the areas of practice that that we should be focusing on and doing more of. There's also a case in there of potentially being able to release funding for additional activity and additional support of the right type if we can get this right. So those are some of the ways in which we would like to use economic evidence. And in summary, I would say that economic evidence is vitally important for this area of policy, for the area that the Autism Alliance particularly focuses on, and will be used in some very practical ways, as I hope I've demonstrated. So I hope that's been a helpful summary. Always interested to hear from researchers who would like to collaborate on this area of policy, and looking forward to the discussion.
Amazing. Thank you, Adam. Thank you, Peter, for your perspectives. Well, we have time now for discussions, and yeah, we have a healthy 15 minutes, 14 minutes now. Shall I stop sharing so we can see each other a bit better? You're very welcome to put questions in the chat and also raise your hands virtually. So that's good questions. Martin, can I ask you, if you don't mind, to kind of tell us a bit more about the future of the Essence and our plans and how people maybe can help us as well?
Yeah, well, okay. So a couple of things really. One would be so the current Essence work and the previous work we've done has been funded through the NIHR School for Social Care Research, and the current phase of that school ends in April, but there is a new phase of SSCR which starts in May for 5 years, and that will have funding for research for capacity building. Some of you I know on the screen on the call have had capacity building awards or other awards from SSCR, and so there's be lots of new opportunities for those, and we're definitely keen to keep the Essence project going, so we will be seeking to get further funding to take things forward. And as Shari said, we want to expand, do more in the children's social care area, which is increasingly happening now, increasingly being looked at by NIHR, by DHSC, even though it's actually a Department for Education policy responsibility. So we think there's lots of potential for adding things in from that area. So, during the meeting, so Lisa Trigg, who chairs our steering group, is in the call today, and we've been discussing, what another phase of Essence might include. So anybody on the call today, if you have any thoughts for things we could do or do better or drop even, perhaps do let us know. That'd be really good.
Yeah.
Yeah.
Okay, good. Yeah, I see that there is some Happy is asking, is there any research around the economic impact of international recruitment in adult social care?
So Magda and I, with colleagues, have been doing some work on migration and health and social care, and particularly looking at how migrants can help with filling gaps in the health and social care system and what the economic case is for that. So we were funded privately by somebody who was a migrant into the UK in the kinder transport in the 1930s, and she wanted to make a difference with some resources she has. So we'll have that report soon. But I know, quickly just saying a bit more, there's the policy research unit in health and social care workforce, which is at King's College London. They have been doing some work on international recruitment in social care.
We have colleagues. Lisa is asking to know more about SEEN and how SEEN might fit.
Thank you for the question. SEEN stands for Social Care Economics Network, and quite a few of us on this call are part of the network. And if anyone would like to join us, I'd encourage you to contact Magda and myself. You probably have her email address. So we've had one meeting. The network's open and available to anyone else who's interested. And we've all got an interest in social care economics. And we're working really together to find out what are sort of the key interests and the things that are emerging as research evidence or methods or data that are of particular interest to people. So we're really kind of listening and learning as well. And how it's related really to Essence is that everyone on Essence has helped Magda and myself set up the network. You know, we're very interested to support social care decision making through economics. So, you know, we've got people from all over England and colleagues from Wales and Scotland as well. So if anyone wants to contact us as well, if you've got any queries, we'd be very happy to answer them. Thank you.
Thank you so much, Ellen, for stepping in. Thank you. I see that we have a question from Jackie about the children essence and whether we have been working with the children's social care, workforce children's social care. Shari maybe can expand a bit more with Martin as well. So we have learned a lot from what work from children's social care, and I think there is a lot in our current framework. Shari, do you want to say anything more?
I wouldn't say that we have partnered with them. It was just adapted from their framework that they have available online, but that is something possibly to look into potentially. Martin, do you have any thoughts on that?
No, I think so. So I think in the children's area, we are, you know, as a country, we're quite fortunate in having this What Works Centre, which has been brilliant at bringing together evidence across many different areas of support for children. We haven't got anything equivalent in quite the same way for adults who use social care services or might provide support. So yes, I mean, the children's component of Essence is relatively new the last few months, really. So we're finding our way through. So Jackie, we might come to you for some guidance on that as well, given work that you do and so on. So yes, I think we will have to pursue that more rigorously in the future. Good.
Thank you.
Thank you.
Yeah.
Michela, there was another question in the chat that Angie posted. So it was a question when you're registering. So what are the key challenges in incorporating economic evaluations into social care decision-making processes that you have experienced through your research, and how did you address them?
I can say something just quickly, and I'm happy, I'll try and put in. So just a few years ago, I did some work, well, I did some work in trying to understand the challenges of moving from research evidence to policy and practice impact. And the focus, there's a paper, I'll put the link in a moment to the chat. The focus is on mental health. So we're looking at, I've done lots of work in the mental health economics area. And we're trying to understand, you know, why it's difficult sometimes for what looks like beautifully obvious recommendations from research to have an impact on policy and practice. And I think in the social care context, there'll be similar issues, because quite often social care, and I won't go through detail now, but I'll put the link in the chat. But quite often, social care intervention will have an impact in the social care sector, but the housing sector, the education sector, the health sector, and so on. And aligning all those different decision makers and budgets can be quite difficult. The incentives can be quite challenging, I think. Also, I think sometimes interventions in social care don't have immediate impacts, but do have longer term impacts and don't show themselves very quickly. And again, that can make the decision making by public sector bodies, for example, quite challenging, because they want to see returns to their investment, if I use that term, quite quickly for political purposes or whatever else. So, so there are some challenges, I think. It's much harder, I think, in social care to move from evidence into policy influence and practice change than it is in many other policy areas for those kind of reasons. I'll put something in the chat anyway. Thank you.
Thank you, Martin. Yeah, and I see that a lot of colleagues are moving to other meetings. I know we are all very busy, and I was wondering whether there is any last questions that we want to kind of share, particularly to our guest speakers as well. Adam is still connected with us. But definitely there is opportunity to stay in touch, really. We have shared our contact emails, and also Adam's emails will be in the presentation. So I'm sure he will be very happy to follow up. And also you have the opportunity to navigate the Essence Toolkit in your own time and come back to us, please do, with any suggestions that you might have. As Martin mentioned before, we would really love to hear from yourselves so we can do better in the next phases, really.